Dr. Traci Patterson from Holistic Centered Treatment is our distinguished guest. She won our award for Healthcare Innovation and Excellence. Thank you for joining me today.
Thank you for having me today. It's a pleasure being able to do this interview with you and share a little bit more about what we're doing here at Holistic Centered Treatment and even my own personal journey with CRPS. So again, thanks for having me.
It's our pleasure. Shall we jump? Holistic Centered Treatment is redefining the status quo.
Holistic Centered Treatment is achieving remarkable results for CRPS patients, and that's how we're changing the status quo.
Can you discuss how Holistic Centered Treatment is achieving remarkable results? And for those not familiar with CRPS, provide some insights.
Yeah, let me jump in and tell you a little bit more about Holistic Centered Treatment, but more importantly, starting with a little bit more about CRPS. Essentially, CRPS is persistent and debilitating pain, and that's the overarching life-altering symptom of CRPS, or complex regional pain syndrome, for sufferers, and they have to face that on a daily basis. It is considered a rare and curable disease, and it affects the autonomic nervous system. CRPS is often triggered by an injury, a strain, a sprain, a surgical procedure, but the reality is that's not always the case. And typically it presents in a particular body part like an arm or a leg, but again, CRPS can show up anywhere in the body. And alongside extreme pain, patients experience a myriad of symptoms, including sensitivity to touch, temperature changes, coloration changes, as well as joint stiffness, swelling, tremors, even muscle spasms. And if the range of physical symptoms is not enough, CRPS remains, again, without a cure. And traditional treatments are focusing merely on managing the pain or treating their physical symptoms, and it's just not working. So to work on treating CRPS effectively, you have to be able to break the pain cycle for good and providing CRPS patients the things that they need to be able to move forward so they don't have to succumb to that bleak reality that's out there. And that's where Holistic Centered Treatment comes in. We're providing the only program, in my knowledge, that's created by a CRPS survivor. And Holistic Centered Treatment is working with a curation of different treatment modalities. So consider it a multimodality protocol that's an effective treatment program that brings together the best of integrative but also alternative approaches to help the body return to homeostasis, or to get the body back into balance. And that's how it can heal. Utilizing the latest science and leading technology blended with holistic modalities is what's helping Holistic Centered Treatment. And we've developed this transformative program. So when we adapt the program to each individual we work with, that's what's making an even bigger difference. When you treat the person as a whole, physically, mentally, emotionally, and for some even spiritually, that's when positive strides forward can be made.
I can say that I've never heard of CRPS prior to meeting you. I'm in awe hearing about CRPS and how you're approaching it. What are the main services you provide at Holistic Centered Treatment?
Holistic Centered Treatment specializes in the treatment of CRPS, complex regional pain syndrome, and other chronic pain conditions. We've seen central sensitization syndrome, fibromyalgia, AMPS, just straight neuropathic pain, small fiber neuropathy, chronic migraines. And essentially, we're redefining that healing experience by the integration of holistic modalities along with cutting-edge science. My view on this is that we're providing a 360-degree individualized approach to treating CRPS and chronic pain, and no one else is doing that. Think of it as a blueprint that can be customized to each patient, specific to their needs and their goals. And our approach focuses on treating, again, the whole person while addressing coexisting conditions.
Can you tell us more about CRPS?
I already went a little bit into CRPS. It was formerly known as RSD, reflex sympathetic dystrophy, and it's also known as a chronic neuroinflammatory disorder. The level of pain measured is one of the most severe levels according to the McGill pain scale, which is a university pain scale. And most patients describe CRPS as a burning, stabbing, gnawing pain. And the symptoms of CRPS can greatly impact the function from everything that a person deals with through their life. For the affected area, it affects their sleep, it affects their activities, and it even affects our overall mental health because it causes stress, anxiety, depression for some people.
How did your personal experience of CRPS translate into holistic-centered treatment?
Yes, I was diagnosed with type 2 CRPS following a foot and ankle surgery that went awry, and that's the nicest way I can put it. Like so many other CRPS patients, I tried the route of traditional medicine, from medication to years of physical therapy, blocks, even to spinal cord stimulators. But when conventional medicine failed and it only progressed my CRPS, that's when I didn't have a choice but to turn to integrative, alternative, and even holistic medicine to be able to regain my life. So after 7 years of what I'm going to call barely surviving and really feeling like I was in the depths of hell, I was fortunate to gain long-term remission. And yes, my personal journey with CRPS is what drove me to create the program that we're currently working with, as well as publishing a book about my own personal journey with CRPS called Stepping Outside a Box, a journey from invisible pain to invincible living. And I want CRPS patients to be able to experience a transformative way of healing where they can go from merely surviving to actually getting their life back and thriving again.
I can tell you're passionate about CRPS and your work. How does holistic-centered treatment's unique program work to overcome the severe pain?
Our focus is rooted in the importance of a balanced and foundational approach to treating CRPS and chronic pain along with coexisting conditions. And not all standard treatments are bad, and not all alternative treatments are good. In fact, we believe it's important to incorporate the best of each in an integrative program that's multimodality and evidence-based. Holistic Center Treatments program works with the biology and the physiology of the human body, and even the biology of pain. This philosophy assists with what we're going to call systemic neural adaptation, balancing the autonomic system and helping the body to return to homeostasis. And it's this approach that's aiding the majority of our patients in getting their lives back, reaching their goals, and many of those patients are even getting into what we call long-term remission.
In your opinion, what do traditional treatment plans fail to consider or incorporate in their approach?
Traditional treatments are going to include medication, physical or occupational therapy, blocks, spinal cord stimulators, etc. And the reality is when it comes to CRPS, these are mere Band-Aids as they focus on the symptoms rather than getting to the mechanism that's driving CRPS. And ultimately, that's fight or flight. So to effectively treat CRPS, it's important to treat the person as a whole.
How does holistic-centered treatment ensure it meets the needs and desired outcomes of the individuals it treats?
To help us ensure that we're meeting the needs of each patient, one of the first things, we ask our patients to listen to their bodies so that we can listen to them. This enables us to see how they respond to each treatment modality and then adapt the program accordingly. Our focus is we're as individualized as our fingerprint. Therefore, to create a successful program, treatments have to be personalized to suit the different needs of each individual. It's really that simple.
Can you tell us more about your commitment to never incorporating anything in your program that causes pain?
Yes, I'm 100% committed to making sure that our program is adapted and that we're not causing unnecessary pain. When we cause pain, it naturally pushes the body into fight or flight, and this is only going to drive CRPS and cause a flare. So when we provide a healing, caring, compassionate environment, and we go out of our way to ensure that no treatment modality is going to cause pain or make a diagnosis worse, that's what sets us aside. Our program's focus is providing CRPS and chronic pain patients with a world-class program and protocol that's dedicated to help them reach their goals.
Is there anything else you would like to add?
Absolutely. Our message is simple. Patients with CRPS and chronic pain don't have to suffer, not in silence and not through cries of agony. Traditional allopathic medicine may not have all the answers, but when we combine evidence-based treatments with the latest science and technology, we can begin to help patients regain function and ultimately help them get their lives back on track. Yet it's possible only when we address all aspects of a diagnosis and how it's affecting that individual, again, physically, mentally, and even emotionally.
I'm impressed with your work and your passion. If someone is interested in learning more about holistic-centered treatment, how can they contact you?
We always offer free consultations via telephone, even via telehealth or Zoom. So if individuals want to learn more about our program, I encourage them to contact us. They can email us at info@holisticcenteredtreatment.com. They can visit our website at holisticcenteredtreatment.com. They can even contact us on our toll-free line. It's 844-994-0999. Thank you again for the opportunity to help get the word out about holistic centered treatment and also help us spread a little bit more awareness on CRPS. Again, thank you so much for this opportunity.
It's our pleasure.